Hello, hi, good evening. Welcome to AccuCheck Wealthy. We are here to help you, motivate you, encourage you with a lot of information, a lot of knowledge sharing, which can help you yourself take care of your family, your loved ones, and your own health. Today's topic is going to be very unique. As you can see with me, I have a special guest who is going to help us understand her health journey and actually tell us, being a doctor, how does she handle her patients? What are the, scenarios related to diabetes management? How to take care of them? What does prolonged exposure of diabetes lead to? All of these things are very very essential for us to know, क्योंकि हमें ये तो पता है कि डायबिटीज बॉडी के लिए अच्छा नहीं है, बट अगर वो अच्छा नहीं है तो किस तरह से वो बॉडी को हार्म करता है, on what are the prolonged effects is what we learn from today's guest. Before that, let me greet each one of you personally. Hello Vivek ji, good evening, thank you for sharing today's session. Hello Nayan, glad to see you constantly for two sessions. Hi Prabjot ji, happy to see you after a long time. Thank you for joining us. Hello Mr. Terkhedkar, I really have to appreciate you. Very, very regular in all the sessions. Thank you so much for your constant motivation to me, my team, and the AccuCheck Wealthy program. Hello, Mr. Chakravarti. Thank you for joining. I hope you are taking good care of yourself. Hello, Pramod Gautam ji. How are you? Thank you for joining today's session. Hello, Mr. Reddy. I hope your blood sugars are under control and you're taking care of your BMI as well. Hello, Shaktiधर सिंह जी, कैसे हैं आप? I hope आपकी तबीयत अभी ठीक है. Hello, Mr. Sanjeev. Thank you for joining us today. Glad to have you as a part of the AccuCheck Wealthy team. Hello, Jijo. I did not see you in few sessions in between. Good to see you back now. Thank you for joining again. Hello, Sumit Kumar ji. Welcome to AccuCheck Wealthy program. Thank you for joining today's session, and we will have more conversations. Um, to all my lovely AccuCheck Wealthy family, thank you so much for joining today's session. We are happy and glad to have you here. Today's session is going to be very special. It is going to be something unique, which is going to help all of us understand what are the prolonged effects of diabetes. And we have a special guest here. Let us know. I'm sure many of you must have met her in some of the sessions around last few months. Let us introduce our special speaker. We have Dr. Premalata with us today, a senior clinical expert, a part of the Wealthy team who's responsible for creating the amazing content to conduct various research patterns for all of our programs. She has great knowledge regarding diabetes, hypertension, cardiovascular health, and a lot of ailments. We are very happy to have her as a part of her team, and we are glad to know a lot of things from her today. Welcome, Dr. Prema, to the AccuCheck Wealthy session today. Over to you.
Yeah, thank you, Rutuja. Yeah, good evening, everyone. Hope everyone are doing good. So, on behalf of Roche, Akuchek, and Wealthy, we are very excited to invite you all to this webinar entitled Prolonged Diabetes and its Effects on the Body. Actually, this session aims to shed light on long-term implication of diabetes and provide insights to its management, especially, and if required, prevention too. Understanding the prolonged effects of diabetes is very crucial for several reasons. So most of us might think, why actually we should think about diabetes? Why we need to know about diabetes, right? I hope we are into it, right? So mostly this is crucial to know that it's essential to know about the comprehensive patient care, prevention of complication, and development of effective treatments as well. So usually it's a proven fact. Like whenever my patients ask question, why ma'am insisting so much on diabetes? Why it's just diabetes? So as we told in the previous sessions, it's just like a roller coaster where some of us used to enjoy, some of us even get panic on looking into diabetes. It is a roller coaster, right? But we, Roche Akuchek Wealthy, want you all to enjoy yourself in terms of emotional well-being, in terms of quality of life with diabetes by keeping it in control. So usually it's a proven fact that most of us, I'm not sure, we all know, like from head to toes, it can affect overall well-being. But we should decide how we should overcome it and how to manage blood sugars to get control, because it usually results in a variety of health issues. So first, effect of prolonged diabetes in cardiovascular system. See this slide, as we all can discuss, like it's involving head to toe. See, it starts from stroke and ending it to peripheral neuropathy, right? From head to toe, it affects each and every organ. So what will be the effect of diabetes in specific systems, and how we are taking it control over it, and how we will be maintaining the emotional well-being and quality of life. This is what the session is about. So practically we don't know many things, like in if it is a festive season, how to maintain, if it is a hyperglycemic episode, how to maintain. So all these things we are going to discuss in today's session. So with respect to effect of prolonged diabetes in cardiovascular system, we know very well, like uncontrolled or poor control over blood sugars can damage the arteries as well. Usually we could see increase in triglycerides and total cholesterols, especially low density lipids, LDL would rise. So leading to even blood clots. Okay, clots we used to, blocks, that is blocks we used to face. So it is a main reason for a cardiovascular disease. So if your sugars are under control, nothing to worry. Otherwise, you have to look into. So what happens because of the prolonged diabetes in cardiovascular system is, first, coronary artery disease, which we should know that it significantly increases the risk of developing coronary artery disease. So what happens in CAD, which we call it as coronary artery disease. So blood supply, it usually it's narrowed, it reduced. So we used to call it as ischemia, like blood supply reduced to a particular organ. Why? So due to atherosclerosis, where our blood vessels are narrowed down, sometimes it gets hardened down to lead to atherosclerosis. So it can lead to angina, which is our chest pain, or a heart attack too. So prolonged diabetes, that too, if your blood sugars are uncontrolled, surely please look into it. It may lead to a coronary artery disease, leading to a heart attack. Similarly, cardiac failure. So where usually in cardiac failure, the heart is not able to pump efficiently to meet the body's needs. See, if our body is to be healthy, overall blood circulation should be in a proper systematic way. Here it gets impaired. So the risk of heart failure is occurring due to the impaired blood supply arising as a result of prolonged diabetes. Then peripheral artery disease. Usually, as we told earlier, like it is characterized by narrowed blood vessels. So in the legs, usually reduced blood flow and increased risk of infections. So leading to foot ulcers and leading to amputations also. Amputation, usually we used to remove a portion of our lower limb, or toes or something like that as a result of foot ulcers due to prolonged diabetes, that especially uncontrolled diabetes. Similarly, stroke. Here, with respect to stroke, it is about 1.5 to 3 times higher in people with diabetes than people who doesn't have diabetes. So diabetes is a risk factor for cardiovascular disease and stroke too. So dyslipidemia. So people with diabetes have changes in the cholesterol levels. As I told you earlier, increase in triglycerides, LDL cholesterol. Usually in common terminology, we used to we used to tell them as bad cholesterol. So LDL, VLDL, everything, it's increasing, whereas HDL, it's decreasing. These changes increase the risk of atherosclerosis. So it is hardening the blood vessels and narrowing the passage of blood flow also. Hypercoagulability, it means the state of blood where it is more prone to clot. So if the clotting mechanism is much more higher, obviously we could see number of blocks. So it increases the risk of heart attacks and strokes. Effects of diabetes on stroke. Obviously, I told you earlier, diabetes, it increases the risk of stroke, that is 1.5 to 3 times higher experiencing in a diabetes than those who doesn't have diabetes. So atherosclerosis, I told you, where blood vessels become narrowed and hardened due to fatty deposits. So what happens? Obviously, reduced blood supply to brain, resulting in ischemia. Ischemia is nothing but reduced flow of blood. It is applicable for all the organs. Here in stroke, especially, it reduces the blood supply to the brain. So hypercoagulability, we have discussed earlier. The main problem here is worst outcomes after stroke. Like people with diabetics have worsen outcomes, including more significant disabilities and a high risk of mortality, which is death. So this is what the worst outcome after stroke. Then recurrent strokes, usually diabetes increase the risk of having subsequent strokes after the first event. Recurrent strokes may occur if your blood glucose level is not under control. Then the recovery is also impaired level. See, whenever we are considering about disease, we usually, public health experts and clinical experts, focus on prevention along with the treatment too. So as a part of secondary and tertiary prevention, we need to rehabilitate the patients. So in order to get control over the complications. So here the problem is if your sugar levels are uncontrolled, obviously there is impaired recovery. So obviously recovery is failed here. So apart from diabetes, like if we are having issues like hypertension, cardiac diseases, then obesity, smoking, everything, these are all comorbidities which leads to stroke. So the main problem which we come across in geriatric diabetic patient is vision problem, which you call it as diabetic retinopathy. So diabetic retinopathy is an alarming effect on tiny blood vessels. So one, it is glaucoma, cataract, and diabetic retinopathy itself is. So what happens with in over a period of time as a result of glaucoma, cataracts, and even we have temporary transient vision loss also. So obviously see these are all the main important things which we come across diabetes, but still we have a temporary vision loss. Like once if your blood sugar is not under control, we are able to come across blood vision. So once if your blood sugar levels come to a normal position, obviously you can retrieve from the previous loss of vision. So diabetic retinopathy actually it has a significant impact on vision. So sometimes, it causes blindness too. So what happens here? It's a most common diabetic eye disease. Here, usually leakage of blood occurs, and usually leakage of fluids, which causes retina to swell and form deposits too. Usually it alters the functioning or physiology of eyes. So we have various kinds of diabetic retinopathy, but please remember, like uncontrolled blood sugars affects your vision drastically. So always have an objective to keep the sugars under control. So we have diabetic macular edema also apart from retinopathy. It's a condition arising as a result of diabetic retinopathy where the central part of retina, which is responsible for sharp vision, it's getting altered. Like fluid accumulation occurs due to leaking of blood vessels, so lead to swelling and vision loss. So fluid collection may happen within the orbital cavity. So it leads to vision loss. So similarly, cataract. So we all very well know in our day-to-day life, it's not diabetic people alone who has cataracts. So geriatric people usually in their older age, they get cataracts. But still, while cataracts can affect anyone, people with diabetes develop cataracts at an earlier age than those who doesn't have diabetes. So it shows us that diabetes brings more riskier or likelihood ratio to acquire cataract. Okay, so these also results as a result of diabetes, and it's nothing but clouding of lens leading to blurred vision. So glaucoma, it's a double risk thing, which actually damage of optic nerve occurs due to elevated pressure. In case of glaucoma patients, we are able to see an hypertensive case, like pressure is much higher within the orbital cavity. Okay, so this leads to vision loss and blindness as well. So transient vision changes, which I have told you earlier, fluctuation in blood glucose levels can cause temporary vision changes, but still, once your blood sugars are stabilized, vision typically returns to normal. This is how we call it as transient vision changes. Blurred vision, reduced pupil response, and double vision. So sometimes, double vision. So it's not about optic nerve alone playing a vital role in diabetes or vision or whatever it is. There are muscles. It has control over the eyeball movements. So here in double vision, because of these uncontrolled diabetes, muscle movements are restricted. So we are able to have a double vision. Okay, so it's quite pathetic. So that's why we insist you that you handle your diabetes in a proper way. Especially we can deal it happily also if you are following a systematic way of managing diabetes. Similarly, diabetic foot ulcer, which we come across more often, where damage to nerves, especially blood circulation, is prohibited, causing foot ulcers. So what happens? Usually, sometimes ulcers are not detected and it was not treated on time. Patients can get infectious, and usually it leads to gangrene. So it's a kind of dead cells, right? So it leads to amputation, amputating either a part of the limb or a part of the toes. So what we have to maintain here, why it occurs and how we can maintain. So peripheral neuropathy is a main cause where nerves in the feet become damaged, leading to numbness, reducibility. So sometimes we are not able to feel the pain, heat or cold, sensory loss. Okay, so because of the sensory loss, we are not able to predict, like we are working on the very sharp object or hitting a sharp object or working on a smooth floor or whatever it is, we are not able to predict or distinguish Okay, in that case, it results in a minor injury, even if that injury will be unnoticed and it may progress to ulcers. So, poor circulation here, usually it leads to peripheral arterial disease, which we discussed earlier, like narrowing or blockage of the arteries in the legs. So, reduced blood flow occurs where it impairs. First thing to be noted is it impairs wound healing. So when it impairs the wound healing, obviously it increases the chance of or risk of infections, making ulcers more likely to develop and harder to treat. See, if your sugar levels are not under control, it's not that easy to treat a diabetic foot ulcer, which we call it as DFU. So it alters the immune system also, because our immune system plays an important role in fighting any sorts of infections. Here, even a minor wound become quickly infected, leading to more severe ulcers. It happens usually with people who has uncontrolled diabetes. It leads to foot deformities also, leading to muscle weakness, etc. So provided if you have a dry skin, please take care of your foot, because it can pave or show a way for entry of infections by cracked foot. Okay, so we can maintain by keeping our feet clean, dry, and protected. Similarly, calluses. Usually, people with diabetes are more prone to develop calluses. If it is not managed, it can break down and turn into ulcers. Similarly, trauma is quite often in case of uncontrolled blood sugars or diabetic patients. Because of reduced sensation, we are not able to notice or feel the extent of trauma even which we are going through. So, for example, stepping on the sharp objects, see, sometimes we will not be able to feel like, oh, we have not we have stepped on a sharp objects. So, usually trauma is a main scenario with respect to foot ulcer. So, please take care of your feet if you are diabetic. So, have a good control over your blood sugars. Charcot foot, it's a severe condition associated with diabetes where bones of foot becomes weakened and can get fractured very easily. So the foot can become deformed, leading to pressure points and ulcers. Such then infections also, risk of deeper infections also much higher. Developing osteomyelitis, it's like infections in bone. It is also much higher. So given the significant risk of foot ulcer in people with prolonged diabetes and prolonged foot care is very crucial. So diabetic neuropathy. So far we have discussed like diabetes is a disease which affects from head to toes. So here regarding diabetic neuropathy, we told earlier, like it damages the nerves, it damages the blood vessels, everything. So here damage to the nerves are at a higher risk. So it is termed as diabetic neuropathy. So usually we are classifying into peripheral as well as autonomic neuropathy. The main symptoms is numbness, tingling, burning of hands or feet, vision problems we do have. Similarly, chronic pain, sensitivity to touch, loss of balance, weakness, erectile dysfunction in males, vaginal dryness in females. Oh, these all occur most frequently in case of diabetic patients. Uh,
Hello, users. I think due to some technical error at Dr. Prema's end, there is a challenge. Please allow us 5 minutes to check what is the technical issue, and we'll help you shortly. Yes, Dr. Prema is back. Let's hear from her again. Hi, Dr. Prema. Is your internet fixed?
Yeah, actually, today it's rainy and there is some
No
problem with the.
worries, no worries. No worries, no
I'm so
worries.
sorry, guys. I'm so sorry. We are back. Please don't
Yes,
mind. Yeah.
please continue.
Yes. So, apart from diabetic neuropathy, what we really experience here is um, totally we are not able to walk in a platform. Like we are not able to distinguish whether it's a smooth platform or better to wear uh, well designed chappals at home also. That would be highly beneficial, very soft or something like that. So the actually that's why we insist that keep your blood sugars under control with the help of healthcare providers. We are ready to help you in all means. So the next complication which we come across is gastroparesis. So we all know once we eat orally, it enters into esophagus, stomach, and then the whole contents of stomach has to be emptied to the small intestine. Here, the vagus nerve is damaged. Vagus nerve is an important nerve. It is giving important activity to the abdomen, especially. Here, vagus nerve is damaged. So, here what happens? Gastric emptying doesn't happen. Okay, so delayed gastric emptying. Slowly, the food particles or contents in the stomach enters to the duodenum. It's a small intestine. So what we experience is even if you take a small quantity of food, we feel fullness. We are not able to take properly. So that is called as gastroparesis. Here we are able to experience heartburn, nausea, vomiting. Always feeling of fullness always will keep us in a uncomfortable position. Okay, uncomfortable position, like we are not able to eat. So we feel to eat, but we are not able to take it properly. Feeling of fullness will make us feel always discomfort. Bloating happens, loss of appetite, weight loss, stomach spasms. All these happens as a symptom. So what happens is usually the gastroparesis can make diabetes worse by adding to unpredictability of digestion. So usually it is very challenging to insulin time doses, leading to either unexpectedly high blood sugar or low sugar. So if gastroparesis is there, you are not able to take food at regular intervals, we can't split. So when you are taking medications, so when we are good at medication adherence, obviously it will give you a hypoglycemic episode too. So this is also a important symptom or a complication which has to be addressed. So kidney damage, yeah, most of the people, even not into the field of healthcare system, they very well know, like always uncontrolled diabetic levels, they affect kidneys. The kidneys, the main function of physiology of the kidneys to filter the waste products where it is not possible here. So the ability to filter waste, it's not in a proper track. So the renal failure also may occur if you have uncontrolled diabetes. Please keep this in mind. Like, see, we can keep diabetes in a good way. As I told you, we can enjoy as a roller coaster. We can keep blood sugars level in a good control so that we can live our day-to-day life happily. The most common sign of kidney disease here is presence of protein in the urine. So the main function of the kidney is it has to excrete what has to be excreted. But here what happens is which has to be observed and kept safer will be excreted so that we will get all sorts of trouble. So once if your renal impairment occurs, obviously it is indirectly affecting cardiovascular system, respiratory system, everything. Like parallelly, it is getting in loop with other systems. And it's a main reason where it leads to fatality or mortality. So mental health, usually, at one point of time, we are not able to eat what we like. One point of time, we are not able to do what we love to do. So in that condition, obviously, mental health will be affected. So usually here, what patient experiences are anxiety, stress, and depression. Diabetes is emotionally draining and cause depression in people, but please do not worry. We Roast Akuchek Wealthy, we are always beside you in taking it under control of us. Do not worry. So we are here that you not get into the depression. So we will always help you, and taking help will always prove beneficial. So tooth decay, many of the complications doesn't involve tooth decay at all. But tooth decay is also a main complication with respect to diabetes, because we also already we have discussed, like nerves are damaged, blood vessels are damaged. So obviously it increases tooth decay and gum infections. So it's seen in more commonly in people with diabetes. They are more prone to periodontal disease. So they need to consult a dentist once in every 6 months. That will be better. Highly helpful too. So how to prevent long-term complications of diabetes? Yes, exactly. This is what this session is focused. First thing, blood sugar control. Regular morning monitoring is very important. Medication adherence. So if you are under oral medications or insulin, it's not a problem. Like, take all the prescribed medicines consistently and discuss any side effects or concern with your doctor or any other healthcare providers with whom you are in touch with. So insulin therapy, if prescribed, use insulin as directed by the healthcare providers. So if your sugars are not under control, and usually if you're giving 10 the units of insulin, obviously later you have to check your blood sugar levels, and you should give a corrected dose also. So proper education regarding insulin therapy and diabetes is mandatory for each and every diabetic patient. So lifestyle changes is required. Medication adherence is required. Being proactive, it is very important. Check blood sugar levels daily. Consulting a specialist in this case is mandatory. So what to do, when, how, all these are the questions to be answered by your healthcare providers. So make dietary changes with the help of our health coaches. And they are very expertise in prescribing your proper diet. So that will help you to maintain your blood sugar levels. Avoid alcohol and smoking. Take care of mental health. Here, in case of dietary management, please limit your sugars and refined carbs. Have a well-balanced diet like whole grains, healthy fats. Remember, healthy fats, plenty of fruits and vegetables, like at regular intervals, and count what you eat. So it doesn't mean the diabetic patient should not eat this, that. Count what you eat, then you are it. So these two, keep it in mind. How much? That is counting. Okay. So monitor carbohydrate intake. So because we used to recommend food items where glycemic index are low. Similarly, with respect to physical activity, engage at least 150 minutes of moderate intensive exercise or aerobic activity, walking or cycling, whichever you prefer, it's not a problem. Please engage yourself in 150 minutes at least every week. Include strength training exercise twice a week, short walks, using stairs, or doing light stretchings. Stretchings, why we prefer is, as age increases, the restriction, stiffness with respect to all the joints, it usually happens as a part of physiology itself, especially in women who come across postmenopause phase. So in that case, better to do light stretching exercise and everything. Have a regular medical checkups. Have a good blood sugar control, blood pressure control, cholesterol control, food care. Like inspect your food daily for cuts, if any, blisters, reddishness, swelling. Keep your feet clean and dry. Moisturize to prevent cracks. Please do not allow feet to have cracks because it will be a source of entry of organisms into your body and it causes infections as well. Okay, do not walk with barefoot. Avoid going barefoot. Wear well-fitting shoes. Have a foot exam at least once a year by healthcare professional if possible. Eye care is very important. Dental is important. Avoid smoking and limiting alcohol is important. One important thing is managing stress. Once you are addicted to the stress, depression, or anxiety, or whatever it is, it will spoil your health. So in that case, engage in relaxation techniques, deep breathing, meditation, yoga, whichever you prefer. It's not like you should do this or do that. Whichever you like. I like meditation. If you like yoga, that is well and good. Do opt for deep breathing. Consider counseling or therapy if required, if you are not able to overcome your stress. So vaccinations is very important because stay updated with recommended vaccines. For a flu shot or pneumonia, people with diabetes are at high risk of acquiring all those diseases. So better to get vaccinated for flu, pneumonia, etc. Okay, educate yourself regarding diabetes. Consider joining a diabetes support group. Usually, see, it's not about business oriented. So if you are guided with the proper healthcare personals or trained personals, so we will be highly in a good way of attaining a good health. Okay, be healthy always. So consider joining a diabetes support group so that healthcare personals they'll be in touch with you. So our objective here is mainly to bridge the gap between the clinician as well as the patients. Sometimes, if I'm a patient, I will have few doubts where I'm not able to ask a doctor or concern a healthcare professional in the hospitals immediately. So in case of digital therapeutics, what happens? We will just type our doubts to our healthcare personals or health coach or whoever it may be. So they are available beside you and they are ready and happy to answer your questions always. So they will help you in all means to overcome the complications of diabetes or prolonged problems, everything. So medication review is very important. It's not like one time you're visiting the physician, continuing the same medication over a period of life. Your blood sugar may changes. If it is increasing, obviously the dosage of medicine has to be changed. Even if it is under good control, obviously the medication has to be changed. So medication review has to be done once in a while at regular intervals with your physicians. Please ensure that, because I have seen in my clinical practice, like patients, they take their own medications once initially when they are diagnosed as a diabetic patient, they would have visited the diabetologist. Rest of the time, they alter the doses, they change the medicines, everything they do. And finally, sometimes I have seen people, they are blaming only physicians. Please do not do that. I do not encourage that too. Kindly have a medication review too. So short-term complications. See, these are all the prolonged long-term complications which we have discussed so far. Short-term effects is like, see, once if it is highly out of control, it causes a situation called as ketoacidosis. Obviously, when a patient is in ketoacidic condition, he or she may enter into the coma and even death. Okay, so recurrent or persistent infection may occur, short-term effects only. Then hypoglycemic episode, obviously, it may result, they can cause coma. So we used to think like only high blood sugars can cause coma. It's not like that. even very low blood glucose level can lead heart attacks, can lead coma, everything. So if untreated and if it is not addressed properly, it may be fatal. It is not to make you yourself panic. We are trying to explain what are all the complications of diabetes, but we ensure that we are always available to take you with us. We will travel with you always and keep our sugar controls in a normal thing. It's a quiz time. Like, which one of the following is not a long-term complication of diabetes mellitus? Can you please tell me? Is Zoom chat open? Which one of the following is a long-term complication? So just now we have discussed. Good, very good. The right answer is A because it's short-term complication. Yes, exactly. Thank you for being proactive. We encourage this often because we encourage this to keep yourself healthy. How to prevent complications from type 2 diabetes? We have discussed earlier. Eating a well-balanced diet where if you are preferring for carbohydrate, obviously it should be having low glycemic index. Okay. Then ensure cholesterol levels are normal. Then maintain a healthy body weight. Your BMI should be under normal limits. Take medication as prescribed. Even sometimes I'll be sad to say, in our family also, they used to take their own medication. Okay, it's not, I am not telling in our own siblings, but still I have seen few persons. It's not about, it's a quite common myth which they are handling. So kindly, I would advise you to follow the medication as prescribed by the health expertise, your diabetologist or general medicine doctor, whoever it may be. Okay, please follow their prescription, stick on to the medication adherence, follow their instructions, do's and don'ts. Actually, most of the hospitals, they'll be having education counselors or diabetic diet counselors or whoever it is. So they'll be encouraging you or explaining you do's and don'ts. Kindly follow that and keep it in mind. And we are always beside you along with those people to ensure that you will be having good sugar control. Okay. So here we are very happy to share all these testimonials where most of our patients had good results within a short duration. And they are very happy to share these testimonials too, how they have been improving after joining this program, how the health coach has helped and everything. So really we are very happy. See, even, when we get a good testimonial from a patient where we are treating with, obviously, we are even happy than getting a medal. Yes, obviously, it is self-satisfactory. So we would like to share all these things where our HbA1c has been reduced and we have specific plans. It seems like Wellthy Plus plan, Wellthy Pro plan, Wellthy Premium plans. Yes, for 3 months, 6 months and 12 months. Here actually what I would like to say, more than a plan, our health coaches, our health expertisers will be guiding you to explain your doubts, to clarify your doubts at all means. So whenever you say which is food which is having high glycemic index or low glycemic index. Can you recommend a proper diet for myself? I have fasting blood sugar this much, postprandial blood sugar this much. Our healthcare team as a whole together, they will be working for you, and they'll be always beside you to make you healthy. Like, you will not be in a depressed condition, you will not be in anxiety, your quality of life will be very good. So you can see, this is the main thing which we have published also, like HbA1c reduction in 60% of patients in our program. Like BMI also has been decreased, kgs decreased. So we have too many abstracts which has been published already. But more than this publication, we are very happy that we have our own patients' testimonials with us. So when you say that our help towards treating diabetes is good, really we are happy than these publications. So you will be guided at every steps. So doctor who is prescribing your medicines, so the caregivers, digital health coach will be in touch with you always in guiding in terms of diet, in terms of clarifying your doubt, everything. So we are behind you always at every step to give you a complete care. So our team at your fingertips, please feel with that. So here, this is what the important thing which we have to discuss so far. See, as a women or as a diabetic people, so what we experience is how to have religious fast in terms of diabetic patients, how to deal with hyperglycemic and hypoglycemic episodes, so how to manage illness and hospitalization. So if I'm traveling, how to keep myself arranged, so keep myself good in terms of health. So all these things we should know, because we are at different situations. So obviously we should know handling religious fast is very important. Like, certain things we obviously patients can safely observe religious fast. You should follow careful planning and monitoring. So usually I do not recommend as a whole fast. In case if you are going for fasting, obviously you have to get your medicine dosage corrected also. So blood sugar monitoring is very important in case of fasting. I told you higher blood sugar levels is dangerous. Similarly, low blood sugar levels is also dangerous. That both can lead to coma. So blood sugar monitoring has to be done. So we should look into significant drops or spikes in the blood sugar levels. Similarly, medication adjustments is very important. For example, in case of Ramadan, where fasting occurs from dawn to sunset, the dosage of medications or insulin might need to be changed. So if you're not taking the food as a whole, and if you're giving insulin, obviously we are at the risk of getting hypoglycemic event. So please take care of medication adjustment, blood sugar monitoring. So you should be able to recognize hypoglycemia like shaking, that is tremors, sweating, hunger, irritability. All this happens as a result of low blood sugar. If these symptoms occur, what we have to do is better to break the fast and consume a source of quick acting glucose. Stay hydrated, have a balanced diet, physical activity, break the fast if necessary. See, we have our own religious practices. Obviously, we will not compel anyone to break the fast with compulsion. So you realize your situation, you analyze, and you decide whether we are in a situation to break the fast and decide accordingly. Usually for diabetic patients, we used to recommend to split the quantity of food at various intervals and take it properly and ensure it's a well-balanced diet. So special consideration is if a diabetic pregnant woman is there, generally avoid fasting. Okay, elderly, those with complications, please avoid fasting. Be more cautious or consult with your healthcare provider. So have education and then decide what to do. Okay, so blood sugar monitoring, medication management is very important, and nutrition. So if you are having trouble eating your regular meals, try to consume soft foods. So if you have higher vomiting or unable to eat, sip on calorie containing liquids likewise. So communication with your healthcare provider, please keep it at regular intervals. Inform your healthcare providers, and you should have an emergency contacts. So what are all the day kit you should have? Glucose meter with strips, extra medication and insulins. So ketone strip test strips if necessary, because if you have uncontrolled blood sugars. Similarly, you should have glucose with you, that is non-perishable food sources, and better to have your doctor's number with you. Avoid over-the-counter medications without consultation. So post-hospitalization care is very important. Once if you are discharged, please ensure that you should have a clear understanding of any medication changes made during the stay. See, we would have been admitted either due to hypoglycemia or hyperglycemia. The medications would have been changed. Current blood sugar levels would have been changed. So after discharge, you get a clear understanding from your healthcare providers. Then schedule a follow-up with your primary care provider and discuss with the long-term follow-up, whether this has to be followed continuously or for a short period of time, say if it is a week for 15 days. Similarly, mental and emotional well-being, hospitalization thing, it will be stressful. So engage yourself in relaxation techniques, stay connected with your loved ones, or choose a therapist according to. So proactive management, clear communication, and being vigilant always helps diabetic patients during illness and hospitalization. So always prioritize safety and seek medical advice or attention when in doubt. Okay, celebrations with diabetes. Obviously, we are into celebrations out of different religious things. So either it is Diwali or Ramzan or Christmas or whatever it is. So obviously, the celebrations revolve around foods and drinks and merriments. So obviously, it's a big challenge for diabetic patients. So what they have to do, plan ahead. Meal timing has to be done. Medication, insulin has to be planned. Check the menu and when it will be served. So give your insulin dosage accordingly. Mindful eating is important, like portion control, prioritize proteins and veggies, limit sugars and carbohydrates, staying active, then limit alcohol, stay hydrated, monitor blood sugar levels, be prepared. So it's not like only we are going to experience a hyperglycemic event alone. So obviously we have the risk of experiencing hypoglycemia too. Stay positive. Okay. So if you always think that like blood sugar is not perfect, don't be hard on yourself. Celebrations are occasional events. You can enjoy, that is a roller coaster, but still we can plan accordingly. We take it in a positive way and we enjoy. Consider bringing a dish. Obviously, see, for example, we join with our neighbors, friends, or colleagues in a potluck. So kindly consider bringing a diabetes-friendly dish. So we don't know how many of them are diabetic or. So it's not being in the pattern of medication. It should be healthy, mostly preferred by everyone also. So consider this in two different ways. It should be healthy item. Similarly, it should be preferred by others too. Likewise, you can enjoy without worry. This is considering bringing a dish for a potluck. Okay, so this is how celebrations has to be dealt with. So hyperglycemic and hypoglycemic, traveling with diabetes is very important. First, before, if you are traveling for a long period of time, say if it is 15 days or 1 month, you're out of station, So consult your healthcare provider, schedule a checkup, discuss about your trip to discuss travel plans, and then make necessary adjustments regarding your medications or whatever it is. So packings, medication supplies, so glucose sources, everything. Um, so you can carry with the hand baggages if you are doing an air travel, monitoring blood sugar level, food and meals, everything. Stay active. So these things are very important, but it has to be followed in over a period of time with diabetes. Okay. So obviously, in a nutshell, I want to say that we together are beside you to help you to overcome diabetes always. Okay, you can approach us. We are ready to help you. We will stay beside you for your healthy life, enjoyable life. Okay, diabetes is not a panic condition, but you have to take care of all the things which we have told earlier for past one. Okay, it's not for panicking situation. Taking care of health is an our right. Enjoy and live with a healthy life. Okay, thank you so much. Over to you, Rutuja. Thank you so much. I should thank Rutuja especially.
Sure. Thank you, Dr. Prema. If you could stop sharing your screen. Thank you for today's session. I think our users are highly benefited, and they now realize that how important it is to take care of blood sugars. आपके health coaches जो बार बार आपको बोलते रहते हैं, keep checking, use your meter, try to understand what is your current range, what is your fasting, what is your post meal, 3 months average of your A1C results. All of this is very, very important. And there is a purpose behind that you should not go to level 2 of your disease. Or if you are on level 2, you should not go to level 3 of your disease. That's the whole motto of this program. Definitely, eating healthy, activity, having a good routine is a part of it, but the ultimate aim or what we look forward to as result is not progressing your disease at a very rapid rate. All right. I hope this session helps all of you. If you have any questions for this informative session of today, feel free to drop in the chat box. We have our very own doctor in house available today for us. Thank you, Dr. Prema, for spending that time on a weekend, especially for us. Um, let's hear from all our users if they have any questions. Yes, to all my AccuCheck Wealthy family, please write in the chat box how was your experience in today's session. Uh, Please give a feedback on today's session. Any suggestions, any feedback, we would love to have that. Also, if you want to ask any questions, the chat box is open. Anyways, it was an informative session, and a YouTube link will be available on our Wealthy Therapeutics channel. Please go through it. Also, it will be shared by your coaches on Monday, so that you get sufficient understanding of the entire topic again, and you can go through it several times. All right, Dr. Prema, I think everyone is just trying to recollect all the information we have given. So maybe if you want to highlight or if you want to summarize today's session in 4 to 5 points, that would be really helpful for our users.
Thank you so much, Rutuja. 4 to 5 points. Please know that it affects head to toe. So it's not we are looking into eyes alone, head alone, toe alone. So kindly ensure that we should keep our blood sugar levels normal so that it doesn't lead us to several complications. First. Second one, medication adherence is very important in case of diabetic patients. At all means, irrespective of whether it's oral or insulin therapy or whatever it is. Then well-balanced diet is always important. It doesn't mean like we will not eat carbs or we will not eat proteins or whatever it is. So have a well-balanced diet. That is very, very important. Give importance to physical activity. So if we are physically active and if we are vigilant in maintaining blood sugars, obviously we will stay healthy. So need not worry for that. So keep your sugar controls normal, have a good diet, have a proper physical activity. So remember do's and don'ts with respect to diabetes always. So something which should not be done should not be done. So, but related to diet, usually I don't restrict my patients. If they sometimes they like some dish, I'll tell them you can take that. Adjust the calories accordingly. Count what you eat. You can remember in mind. Don't eat in addition since you like it. Have a small quantity if you like it. Prefer for example, money butter masala or whatever it is. So count your calories and eat accordingly. Do physical activity. Ensure a medical review properly with a clinician. Don't take over the counter medication. That is very important. Okay. These are all short tips to be remembered. Other than that, complications we have discussed earlier.
Sure. Thank you so much, Dr. Prema. We have got one question in the chat box. We have Mr. Vivek. Hello, Vivek ji. Good evening. He is saying he has got brittle diabetes. How to control my blood sugar fluctuations?
So usually blood sugar diabetes, when I was working initially in a diabetic hospital itself, so while sleep also we will get fluctuations. So what I would recommend is do your blood sugar monitoring regularly. So check first monitor for a while fasting alone. Then later monitor postprandial alone. Then you will get on an average, you will come to a conclusion like, okay, we have fasting in this aspect or postprandial in this aspect. Accordingly, we can adjust the dosage of medications and sir, Mr. Vivek, actually you are under oral medication or using insulin?
Maybe Dr. Prema, this is a very specific case. What we can do is health coach of Mr. Vivek will connect with you, and
Yes.
we can have, you know, separate discussion for this particular
Yes. Yes.
because I think a health coach and understanding his till now history, medical details is required. So
Exactly.
Vivek ji, we have a special session for you, Vivek ji, and we'll help you with that. Uh, Me and Dr. Prema will connect with your health coach, and she will inform you on the next steps. I hope this personalized approach helps you a little bit more so that we can guide, coach, and help your diabetes management program better. All right. Thank you so much, Vivek ji, for reaching out. That's all for today for all my lovely AccuCheck Wealthy family. Thank you so much for being associated with us and spending your lovely weekend with us. Festivals are coming. We are soon coming up with a diabetes, sugar-free, dessert-friendly sessions. Um, we will help you with a lot of information on that. You can enjoy your festivals but in a healthy way. How to do it, when to do it, is what we are here for, and we will take care of you and your blood sugars this festive season. Till then, take care of your health, take care of your entire journey, and as updated by Dr. Prema today, mental health is very, very important. It's time to rest, relax, spend some time for your own self. Till then, we meet again next week with a new speaker, with a set of new information. Thank you. Bye bye.